So let's talk about a common eye problem, which is a stye, and how to get rid of a stye. Now, what is a stye? A stye is basically the blockage of the oil glands in one of your eyelids, which can be the upper eyelid or the lower eyelid. And what you would notice is when you have a swollen lump, which can be quite itchy, it can be sore, swollen, and tender. So usually you have a small lump either at the base of the eyelid, bottom eyelid, or at the top of the eyelid. You can have multiple styes as well. The different reasons for having a stye can be due to stress, it can be due to lack of sleep, it can be due to poor eye hygiene, for example, or maybe you've got overproduction of your oil in your oil glands, which constantly lead to blockage of the oil glands. Some people, if they go swimming, they notice that they develop a stye afterwards. So these are several reasons for having a stye. Some people get worried when they have a stye because they think, oh no, this is quite bad, I'm going to have a really bad infection. But in most cases, a stye actually goes away by itself without needing any major form of antibiotics. And there are lots of home remedies that you can use, to get rid of a stye. How do I get rid of a stye? So to get rid of a stye, one of the most important things is warm compresses, because heat is actually what helps to open up the oil glands, which actually allows the oil to kind of be a bit more watery, and the body can actually absorb the oil back into the body. Or in some cases, you might notice a bit of discharge coming from the stye, and that's the body releasing the contents of the blocked oil gland. So warm compresses, a simple flannel in warm water, apply it to the eye for like 5 to 10 minutes. Do that 4 times a day, just for a few days, and you notice that your eye is actually getting better. The symptoms, there's no more itchiness or swelling, and the stye is starting to get smaller as well. In some cases, the stye goes within a few days, or it can take 1 to 2 weeks for your stye to disappear. What some people do is they use what they call green tea bags. They put the green tea in the warm water and they extract the green tea, add them to the warm compress, and then that also helps as well. In rare cases where basically the stye is so infected that you're having loss of discharge, it's quite big and swollen, you can actually use antibiotic ointment called chloramphenicol 1% ointment. So chloramphenicol 1% ointment is something that you can actually apply to the eye 3 to 4 times a day, and again you can do that for 1 to 2 weeks, and along with the warm compresses that would help to reduce the size of the stye as well as the symptoms that you're experiencing. In some cases, a stye can actually become chronic and develop into what we call a cyst, otherwise known as a chalazion or meibomian cyst. And this is when the oil glands get so blocked that you now form a cyst, which is actually inside the eye itself. And usually a cyst is like a pocket of fluid that, again, it can go away on its own, but you might need to do warm compresses for quite a few weeks. And if it's something that doesn't go away on its own, you might need surgery. It's just minor surgery where basically they just nick the inner side of the eyelid and they get rid of the pocket of the cyst. But there's always like a less than 1% chance that the cyst might come back again, especially if you're someone that's prone to styes and getting these sort of cysts. So in short, this is how you manage a stye. It's quite simple, straightforward, usually goes on its own after a few days. Remember to use regular warm compresses. You can use green tea bags. If it's quite infected, sore and painful, you can use over-the-counter antibiotic ointments.